This view was done recumbent, supine, same individual, 5 days later, upright. Now, see down here?
Yeah.
Unilateral localized water density. Posterior lung base. But it has a superior concave shape to it that looks like it's going up the chest wall. Looks kind of like a big meniscus, just like that one over there did. Only that one was much smaller because that was a small amount of fluid. This is a big amount of fluid. This one, would you say that there's a slight increase in density here
Yeah.
compared to here?
Yes.
Yeah. But this one was supine. Patient was laying in a supine position. So where would the fluid go?
In the back of the lung.
It would go all along the posterior chest wall, wouldn't it? It would basically do this.
Yeah.
It's going to be all along the posterior chest wall. But the beam's coming this way. So the beam just sees it as a slight increase in density over the entire lung field. And it's very subtle, but there is a difference between this and this. So stand the patient up, and now you can see they got a big pleural effusion. From this view, can we tell whether it's right or left?
Oh, wait. Are we looking for fissures? No.
Can we tell whether that's right or left? Without this one,
No.
No.
you actually can.
You can?
And the heart rate,
Uh-huh.
depending on the heart rate, how's the position of the heart, or what's showing more.
Do you see one or two hemidiaphragm here?
Two? Or unless that's.
Oh.
Well, you
Right,
only
is it
see one.
Yeah.
Yeah.
See, that's a continuous border,
Yeah.
and I only see one of them. Because it's a continuous border. The other one I can't see, and usually you can see both of them. They may be superimposed, but usually you can see them. I can only see one of them, and so which one am I seeing?
The right.
Right.
How do we know it's the right one?
Because it's higher.
Because of the heart.
Well, we don't know where the other one is. But how
Well,
can we tell?
usually the right one is higher, so if
It's higher, and that's what you see.
you will not see the left side because it's masked behind the increased density.
Does this one go right over the heart,
Yes.
completely visible?
Yes.
Water
So it
density
can't be-
diaphragm,
So it can't be
water
right.
density
First
heart.
left.
Mm.
So is this one right or left of the midline? Because it's not touching the heart,
So it's right.
so it has to be the right one.
So if
Because
it
what
was,
does the left one do at the front?
Touches, so that's the.
Runs into the heart, it's a normal silhouette sign. So if you can see the diaphragm clearly over the heart, it's not touching the heart. The only one that doesn't touch the heart, if the patient has normal positioning, it's not the right, it's not touching the right hemidiaphragm. So this has to be the right hemidiaphragm, which means this is not touching it, which means it has to be on the left side. And there's no left hemidiaphragm visible because this is doing a meniscus right up against the heart also, right behind the heart. So there's fluid all the way above the posterior left hemidiaphragm, and the heart's above the anterior part of it. So the whole hemidiaphragm is being silhouetted on the lateral view. That's why the only one we can see is the right hemidiaphragm. So we can actually look at that and say, well, if this was on the right side, this would do this.
And it would all like bleed.
And it would just blend right in, exactly. But since this goes over the top of it continuously, is over the top of this, these are not touching each other. They have to be like this. Not like this, they'd silhouette if they were like this. They have to be like this. So one has to be on one side of the midline and the other one's got to be on the other side of the midline. They're not touching each other. Because if it was on the right side, it'd go along like this and go right up like that. And then we wouldn't see it back here. We'd see the left one, not the right one. That's a normal silhouette with the left hemidiaphragm. This is an abnormal silhouette with the posterior left hemidiaphragm. So yes, you can tell which one is which. And that's actually how you tell which hemidiaphragm is which. Because the level doesn't matter. The level can change. If you did it left lateral or right lateral, the level's going to be different. It's which one do you see over the heart? That's the right one, because the left one gets silhouetted by the heart.
Can you just quickly, with your pencil, show with the, when I see both of them, kind of
Sure.
what it would look like?
I don't know if we've got
Or
one.
do you have one?
but,
'Cause I,
That one on the bottom?
Yeah, you can see which one's this.
so that would be the right.
See, it goes
one?
right over the heart. And then if you look closely, you got the other one right there.
Okay. So
And
that's how-
it stops right here. Why? Because it's touching
So
this.
that's-
So we know that's the left one, this is the right one, because it's continuous over the heart. And that's how you know, because they're not touching each other.
Right.
The left one runs into the heart and is silhouetted at the front. But you can always see the posterior part of the left one because there's air above it. So when you get to the front, the left one anteriorly disappears because it's silhouetted by the heart. And that's a normal silhouette. It's the same thing with the medial part of it. You know, when you come along like this,
Yeah.
and then the medial one disappears because it's touching the heart. Yeah, and those are normal silhouettes.
How about the right lung on the base? You see two different densities. Is that the liver and the diaphragm?
Right here?
Yeah.
No, there's a little bit of eventration. I
Okay,
think so,
just
that is.
So
imagination.
this
Yeah.
is the diaphragm and this is what?
Yeah. No, this is diaphragm. It's coming along like this. Part of it's elevated.
Oh, part of
And
it.
this is, all it is it's
Just,
like that. So the beam's seeing here and it's seeing here.
okay.
And I think there's probably a little bit of eventration is probably what's going on. Nice plaquing here,
Yeah.
plaquing here, plaquing here, here, here. This was a patient with breast cancer, metastatic to the pleura.
Is the left hilus enlarged?
Now, where is that?
I mean, it could be. It's kind of hard to tell on there. It looks a little bit dense on here. Doesn't look overly big. Some of this could even be pulmonary artery. It's a little hard to tell.
On the bottom view here, what were you saying about the diaphragm going, or something continuous up the?
Well,
I
if
missed
if
that
this was
part.
on the right side,
Yes,
then this is gonna come along like this. It's gonna hit the fluid, which would be touching it, and it's just gonna, the density's gonna go right up, because this would silhouette the right hemidiaphragm, if it was on the right side.
effusion would.
The effusion.
Right, okay,
Yeah.
okay, got it.
And so then this border would come along like this and go zoop right up there.
Right.
And you wouldn't have this except for the one on the left side.
Exactly.
You'd
Okay.
see the left side over it then. And then the left one would come along like this and disappear where it runs into the heart, which is a normal anterior silhouette. So the diaphragm that you see over the top of the heart is the right one, unless they have dextrocardia.